Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. So let's talk more about these imbalances, some of the causes of the imbalances, and what we'll notice with the patient and what treatment and we'll give this patient. So firstly, let's talk about metabolic acidosis. So some of the causes of this metabolic acidosis include hypoxia, starvation, seizures, renal failure, DKA, dehydration, diarrhea, as well as fever, and also some overuse of metformin and intraretroviral drugs. And some of the signs and symptoms we're going to note with this patient will include they'll have flaccid paralysis, they'll be confused, they'll have lethargy. Some vital signs that will be off will be bradycardia, some weakened pulse, hypotension, tachypnea, cosmal respirations, warm, flushed, dry skin, and hyporeflexia. And for a patient who's on metabolic acidosis, we normally treat the underlying cause, what is causing this, and we administer fluids and electrolytes. So some disorders associated with metabolic acidosis include, of course, DKA, alcohol abuse or alcoholism, cancer, liver failure, shock, which would lead to hypoxia, anemia, severe anemia, as well as heart failure. Metabolic alkalosis. So when we talk about metabolic alkalosis, what could cause this? We could have excess GI suctioning, right? We are taking out that acid in the GI, and what happens? You just become alkaline. Some diuretics could cause that, some severe vomiting, right? We are getting rid of the acidity in the body. And some signs and symptoms for this will include some nausea and vomiting, diarrhea, hypokalemia. They'll have dysrhythmias like tachycardia. They'll be restless. It will be followed by lethargy, confusion. There will be also a decrease in level of consciousness, dizziness, as well as irritability, and compensatory hypoventilation. There will be hyperventilating to compensate for this alkalosis. Remember, our respiratory system kicks in before our renal. And then the patient will also have some tremors and muscle cramps, as well as tingling of fingers and toes. And for this, we'll treat this patient always. We treat the underlying cause and we administer fluid and electrolytes as ordered. So respiratory acidosis. So with respiratory acidosis, we're talking about respiratory system. So what would cause respiratory acidosis? Of course, pneumothorax. We're not well ventilated. We'll have an airway obstruction. Somebody's choking, inadequate ventilation, patients who are on ventilators, anesthesia because it suppresses your CNS, drug overdose, it suppresses your CNS, COPD, pneumonia, respiratory depression. Some signs and symptoms of respiratory acidosis will be hypoventilation. And with hypoventilation, we're going to notice like hypoxia, rapid shallow breathing, a decreased blood pressure with vasodilation. They'll have some drowsiness and dizziness. They'll have some muscle twitching and weakness, hyporeflexia, dyspnea, headache, hyperkalemia, and dysrhythmias because they'll end up having a high potassium level. And for this kind of patient, how do we treat them? We always reverse if they are on narcotics. If it's a narcotic causing this respiratory acidosis, we reverse it with Narcan, whatever it is. Like if it's morphine overdose, we'll maintain a patent airway. Remember, this is respiratory. Airway always comes first. So if we don't have that airway, whatever you're doing doesn't matter. So maintain that patent airway, regulation of ventilation therapy, and bronchodilators and mucolytics. We need to open up that airway, we need the patient breathing, and we need sufficient ventilation. Respiratory alkalosis. Of course, we're still talking about respiratory hyper issues. So with respiratory alkalosis, what would cause this? Some conditions that can cause this could be asthma, pneumonia, also patients who are being hyperventilated through like for example, anxiety or fear, or when they're on physical education, they're getting a hyperventilation, right? A mechanical ventilator, hypoxemia, and altitude sickness. Altitude sickness, like people who fly and get sick, right? What are the signs and symptoms of this? What would you see with such a patient? They will report chest pain. They'll have seizures. They'll have lethargy and confusion and some lightheadedness. They'll have a deep, rapid breathing, which will be a low or normal blood pressure, okay? Some nausea and vomiting, hypokalemia, numbness and tingling of the extremities, as well as tachypnea, anxiety, tetany, and palpitations, which due to tachycardia. And some treatment for this, what? We'll give them oxygen, okay? Regulate oxygen therapy will reduce anxiety if it's an anxiety issue, if it's physical education, or if they're in fear, we need to make sure that the patient rests. And if it's fear, you need to comfort this patient to bring that anxiety level down. And we'll teach them about rebreathing techniques, right? Some COPD patient, or if it's an asthma patient, sometimes tripod position, pressed lips, teach them how to rebreathe slowly, or some brown bag will actually help them with this condition. And that's it with our electrolyte imbalances and acid-base balance. Our last video in this series will be buns, and I think we'll be wrapped up with our fluid and electrolyte series. See you on the next one. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.